Welcome once again, friend. With the most commonly repeated one-liners in ENT, today we will discuss the part 14 of the series. Myself, Dr. Naren Singh Chauhan. So, beginning with the question number 1. Today we will discuss mainly the acute infection of the ear, that is AOM, and the barotrauma related question, which are most commonly asked in the NEET PG question. So, starting with the question number 1, which says that most common organism causing AOM. Earlier, the answer used to be Haemophilus influenzae, but due to the initiation of immunization for Haemophilus influenzae is national vaccination program, that is universal immunization program. Now, the most common organism for AOM is our Streptococcus pneumoniae. So we have to remind now the correct option will be Streptococcus pneumoniae. If Streptococcus pneumoniae is not in the option, then still there the Haemophilus influenzae will be the most common cause for AOM. Now, going with the question number 2, which says that most common site of perforation of tympanic membrane in ASOM, that is the perforation of tympanic membrane in ASOM is most common site is anterior-inferior. Which site is? This is the anterior-inferior. Now, going to the question number 3, which says that cartwheel sign is seen in. For cartwheel sign, you can also go for the with the image-based question. The link for which is given in the description box. We can also go there and have a look on the cartwheel sign, how actually the tympanic membrane looks in cartwheel sign. So the cartwheel sign is seen in ASOM, and in the video you will also see that what is the reason for the cartwheel sign. So if the question comes, what is cartwheel sign, then we have to say the answer is ASOM. Going with the question number 4, which says that for ASOM, myringotomy is done in which quadrant? This is very important question. We have to remember this. Myringotomy, that is incision over the tympanic membrane for allowing the secretions behind the tympanic membrane in the middle ear, that is usually mucopurulent discharge in case of ASOM, or it may be serous discharge. Then the ASOM myringotomy is done in posterior inferior quadrant, where posterior inferior quadrant. We have to remember this. This is done in posterior inferior quadrant. Now, question number 5. This says that lighthouse sign is seen in which stage of ASOM? Saying lighthouse sign is seen in stage of suppuration. That is stage of suppuration of the ASOM. We see the lighthouse sign. We often see the lighthouse which were used in old days time when GPS were not used, were in function. The big ships used to sail by using the lighthouse sign. Question number 6. This is a newer question for NEET PG exam and becoming most popular question which is repeatedly asked in NEET PG, that is the blue eardrum. Blue eardrum is seen in serous otitis media. Due to collection of fluid behind the tympanic membrane, it look blue. This is known as blue eardrum. Now, question number 7, which says that cause of unilateral secretory otitis media in adult. This question, I will say, very important question for NEET PG as well as for Viva part. If an adult, that is usually the age group of 40 to 45, or sometime in question it will be mentioned that 40 to 50, comes with unilateral secretory otitis media, then the answer will always be nasopharyngeal carcinoma because of a mass in the nasopharyngeal region. This leads to blockage of eustachian tube, resulting in the collection of fluid in the middle ear, forming a secretory otitis media. Then in that case, the cause doesn't lie inside the ear, the cause is in the nasopharynx because of carcinoma. Autophony. But this also contains two questions. What actually is autophony? Autophony is when a person himself heard his own voice again. That is known as autophony. This is seen in case of patulous eustachian tube due to resonance of voice. If patency or eustachian tube patency is not complete or the eustachian tube is patulous, autophony is sometimes also seen in case of hard wax in the ear. So one cause is patulous eustachian tube and another cause is hard wax in the ear. We can have autophony as a symptom. It is the typical symptom of patulous eustachian tube, where the patient will say, "Hey doctor, I myself listen my own voice. मुझे अपनी आवाज दोबारा गूंजती हुई सुनाई देती है." That is autophony. Now going to the question number 9, which says that eustachian tube get blocked if pressure difference is more than 90 mm of water. So this is a slightly confusing question which we have to keep in mind. The answer is 90 mm of water, not 90 mm of mercury. If the pressure between the middle ear and the external ear is more than 90 mm of water, the eustachian tube will get blocked due to the pressure difference. Now, the most important question of today's topic, that is the question number 10. This is most commonly repeated in AIIMS exam. That says that aortic barotrauma occur. Aortic barotrauma will occur when we will descend in air. They will give 4 answers. We will ascend in air, we will descend in air, we are traveling by train or something else. Then the answer will be if we are descending in air and then aortic barotrauma occurs. This finishes with the part 14 of our series. If you like our part, kindly share and subscribe and stay tuned for upcoming parts which are on the series. Thank you.